Hello and welcome to the Yodo channel. I'm Dr. Bone. This channel is where we learn about difficult health topics and we discuss serious illness-related topics in a comfortable environment that is less stressful. Today I want to give some information about a few test results. These test results are important to confirm diagnoses and follow a patient's health status or stages of illness over time. Palliative and hospice patients also have labs that they get done. We don't stop doing those labs. We just may not do as many and we may not do them as often. It's part of following a disease process to get particular labs at a particular time to monitor a treatment or a disease state or evaluate for somebody's health. Sometimes labs may need to be fasting to ensure accuracy, and sometimes labs need to be obtained at a particular time of day. So there are specific things about certain labs that need to be done a particular way sometimes. There are some risks associated with labs, and we'll discuss that as well. Blood tests are probably the most common medical tests. Often lab tests are ordered in conjunction with a physical exam, and it may be to evaluate a risk, evaluate an organ system, or confirm a working diagnosis. Blood work is also a typical method to monitor medications and treat various issues within an organ system. You likely have some lab tests that you get on a regular schedule. Most labs evaluate more than one system. Just as it is difficult to throw a rock into a pond without having ripples, if one organ system is impaired, it's likely to be affecting other organ systems as well. Labs are specific for a particular organ system. However, they can cross over into other systems. There are a few that are specific to one system, but that's not as common. Let's get into some basic information. We're not going to get into the down and dirty, although it might seem like that at times. The CBC is a good place to start. A complete blood count is probably one of the most familiar lab tests for most people, and it certainly evaluates a person's bone marrow's ability to make blood cells, and it can reveal various anemias, whether it's acquired over time or it's a congenital anemia that somebody was born with. It can indicate various cancers, and of course it can provide information about your immune system. The results can also indicate about your iron level and provide information about some vitamins. It may not give the vitamin level and it doesn't give the iron level, but the way the blood cell looks, its shape and its size can tell a physician quite a lot about different vitamins in your body. Blood counts give lots of information about the number of blood cells, their size, their shape, as well as the amount of iron that's present in them. The results also contain information about the platelets, and platelets, if they're not functioning, you may not make your clot very well. A blood count provides information about the number and type of white blood cells and can have particular changes based on bacterial or viral particles that are in your bloodstream or even parasites. A blood cell is born every moment of every day, like a manufacturing plant, like a car plant. And so the bone marrow has a blood cell coming out all the time. And the amount of blood sugar that's in your bloodstream at a particular moment when that blood cell is born tags that blood cell for its life. So one of the other blood tests that we look at is something called the hemoglobin A1C. And anybody that's been evaluated for diabetes knows that their A1C is supposed to be less than 7, and the doctor would like to see it even less than that, depending what their age is. So when that blood cell comes from the bone marrow and goes into the bloodstream, it's immediately tagged for the life of that blood cell as to how much blood sugar was present at that time. And that's why the doctors are checking it about once a quarter, because that's about the lifespan of a blood cell, is about 90 days. So you got blood cells in your body today that are 1 day old, they were just born today, and you got blood cells in your body that were born 90 days ago, and this is their last trip around the body, and your body's going to take those pieces apart and recycle them. So the blood can give a tremendous amount of information to the physician. Next, let's talk about some basic information for the liver, the pancreas, and the gallbladder. These organs are all part of your gastrointestinal system, and they help with your metabolism. They are key for helping your body process medications, vitamins, minerals, food. They have enzymes in them and chemicals that help break down fats, proteins, carbohydrates, and sugars. So the tests for your liver, pancreas, and gallbladder tell the doctor about the health of those organ systems. They can indicate infections, whether it's bacterial or viral, and they can also speak to your nutrition and the health of those organ systems. Albumin and total protein are made by the liver, and they actually can help your body hold fluid inside of the blood vessels as well as provide nutrients around your body. And your liver is supposed to be constantly replenishing those. If a person's albumin or total protein are low, they can have trouble with edema or swelling. And a person might think, I'm swollen because my heart's not working, but it might be because their liver's not functioning very well. Bilirubin is a liver test that it can indicate there's a problem with your gallbladder or your liver. Bilirubin has chemicals in it that are needed for digestion and enzymes that go into your bloodstream, and we measure those to find out what the health of those organ systems are. As far as liver function tests, there are several in this category. Most commonly, we talk about the ALT and the AST, and for people who are as old as me, they may remember when it was called the SGOT and the SGPT. And I'm not going to go into what those acronyms stand for, but you can certainly talk with your physician about them. And one called the GGTP can indicate that your liver is having some trouble if they're really high. There's normal ranges for all labs, but for these, we know that your body's liver is going to leak a little bit of those enzymes into the bloodstream every day. And if we see that number really high, we know there's been some sort of injury or insult or virus or bacteria that's affected your liver, affected your gallbladder, and we need to find out what that is. If there's an insult and it drifts down over time, even if it was just from too much Tylenol, because too much Tylenol can cause problems with your liver. People want to blame liver problems on alcohol. It's not. Alcohol is not the only chemical that can injure your liver. So if there's been an injury or an insult, we want to see how does that change over time. Certainly, depending on how high it is, we may need to know more immediately, and other tests may be warranted. Your pancreas is crucial for your metabolism as far as your blood sugar goes, because that's where your insulin comes from and helps manage your blood sugars. So diabetics know how important their pancreas is. The INR is the International Normalized Ratio, and that is a test that we use to tell us about the body's ability to clot. And those factors not only come from the platelets in your body, but they also come from proteins that are being produced by your liver. So sometimes if somebody's got a lot of liver damage and they don't have very much liver left, their liver function tests may be normal, but their INR will be high, and it's not because they're taking a medicine to make it go high. People that have a heart problem may take a medication that makes their INR elevate, something called warfarin or Coumadin, but if their liver isn't working right, and they're not taking it, it may be high on its own. So the INR sometimes is used to monitor how well the liver's working. Ammonia is a chemical that comes from the liver, and your body is supposed to keep that down. So if your liver's not working to metabolize that and those metabolites are building up, your ammonia level will climb and a person can get really confused. If a person's liver isn't functioning well and their ammonia level is climbing, we can actually give them a medication that helps their bowels evacuate that, because it can trap that ammonia in the colon, and then when you go to the bathroom, you flush that ammonia down the toilet. Now let's talk about some basic labs related to your heart. A lipid panel, whether it's the total cholesterol, the HDL, the LDL, or your triglycerides. I think most people are familiar with that lipid panel, and we do that at younger and younger ages, it seems. So the LDL is the bad kind of cholesterol, and the low density lipoprotein is the one you want kept low. And the HDL is the good kind, and you want the high density kept high, because that's the one that's more friendly and helps peel off that thick plaque that the LDL is trying to lay down. There are various cardiac markers, and we're just going to talk on a few of these because there are so many. But a common one that we use now is one called the BNP, the brain natriuretic peptide. And if your heart's under stress, that chemical can rise, and it tells us that somebody's at risk for heart failure. Their heart's under a lot of pressure. The kidneys are supposed to evacuate that chemical, but if your kidneys are impaired, even if your heart is not having a lot of stress, that chemical can build up in your lab. You have to look at what's causing that to be high. Is it because of heart stress or because the kidneys aren't working very well? Troponin is a heart test that's an enzyme that is elevated when a heart muscle's been injured, so like a heart attack. The physicians will follow that during an evaluation when a patient comes into the emergency department for chest pain, and if they end up getting admitted, they'll do serial troponin levels to follow it. A high sensitive C-reactive protein level, that actually comes from the liver, but when it's elevated, it's a marker for inflammation, and it can indicate stress that's related to your heart or stress for your heart. Another test related to heart issues is the D-dimer. And the D-dimer actually comes from blood clots that are being broken down. So if a D-dimer is high, it might mean there's a blood clot in the body, but it might mean something else. Now, if the D-dimer's low, we're sure there's not a blood clot. So a low test rules it out, but a high test does not necessarily rule it in. See how these are beginning to get really confusing? The thyroid gland has multiple tests, and they're a little bit more specific to the thyroid gland. These lab tests can provide information about the function, whether it's too much or too little. It can also imply there is an autoimmune issue with the thyroid, where the thyroid gland actually begins to attack itself. The thyroid gland does work on its own, but it coordinates with the pituitary and the hypothalamus in a person's brain. Next, I want to talk about some kidney tests. There are various formulas that are being used to calculate a person's renal function. This is a hard phrase for me to say, but it's the glomerular filtration rate, the GFR. And that calculation is mathematical, and it includes numbers such as your age, your weight, gender, and race, as well as that creatinine amount. The creatinine is something that's a normal byproduct of your body every day based on your muscle mass. A thinner, smaller framed person might have a little bit lower daily creatinine, but a more muscular, larger person might have a little bit higher, but it's still a really narrow normal band, like 0.6 or 0.8 to maybe 1.2. So it's really a pretty narrow band for most everyone. The BUN, or blood urea nitrogen, is also something that's made on a daily basis, and if that's high, it might imply somebody's dehydrated or the kidneys aren't working well. But that's another test we use in conjunction with the creatinine to tell us about how well someone's kidneys are working. Your kidneys manage your fluid levels, your blood sugar, your electrolytes, and they can also impact your blood pressure and your heart. They have chemicals or hormones that come from them that affect how well your bone marrow makes blood cells. So they all begin to kind of interact and interrelate and communicate with each other, which makes it really complicated sometimes. Electrolytes are so important, and they're involved with almost every organ system. Electrolytes are impacted by what you eat, what you drink, maybe what you take, as well as the disease states. So they have multiple things that can cause them to change. And there are 4 main electrolytes that we look at: sodium, chloride, potassium, but there are multiple other electrolytes and ions that we check in your blood system. When electrolytes are not well managed, it speaks to a physician as to the extent that an organ system is involved, because the body's really struggling to keep all of those in those normal ranges. So if they're not regulated well, they could have effects on your cognition, effects on edema, your heart, your gut. You could get diarrhea, nausea, vomiting. You could have confusion. It affects your kidneys, your bladder, your blood sugar could be affected, as well as the pH of your blood. Electrolytes, when they're off, can become a vicious cycle, and a cascade of events can begin to occur if the body can't gain control of it. So the medications, the disease states, and the organs that are affected, whether it's acute or chronic, become very interrelated very quickly. That's about the 3,000-foot view for all of this kind of stuff. All of those basics being said, your body does like homeostasis, and that's basically everything staying basically the same. It doesn't like change, and it doesn't like change quickly. If your body changes things slowly over time, your body can acclimate to that new normal. So sometimes we'll have somebody that comes in and we see them and they've not been to a doctor in a long time, and we look at those labs and we're thinking, wow, these are abnormal, and they don't really look very sick at all. It may be because their body's acclimated to it. Or we have somebody that comes in and they look very ill, and their labs are only off a slight amount, and that's because it's happened really quickly and their body has not had time to acclimate. In either situation, we really need to intervene and find out what's going on. We need to do more evaluation. All that being said, there are certain numbers, general rules of, that should never cross. Age should be less than your systolic blood pressure. So just think about an 80-year-old person. You don't want their blood pressure to be 70 or 60. Age should be less than their weight. If you got an 80-year-old that weighs 75 pounds, we got a problem. Age should generally be less than the blood sugar. So if you've got somebody who's 80 years old, we don't want to see their blood sugar less than 90, because they're going to get lightheaded, they could pass out or faint. Now, if you've got a 50-year-old and the endocrinologist really wants their blood sugar to be in the 80s, they're going to tolerate that. It's not going to be a problem. But if you've got somebody who's 80, 90 years old, we really need to be careful, and American Geriatric Society even agrees that we don't need to push their blood sugars too low if their age is high. Potassium should be less than a hemoglobin. So potassium value, if that starts climbing up 5 or 6 and the hemoglobin starts dropping down, those are numbers that should not cross. We don't want to see a potassium of 6 and a hemoglobin of 6 at all. Creatinine should be less than your potassium. We don't want to see that creatinine up around 4 and the potassium down around 3. Creatinine and albumin. Again, we want to see that albumin higher than what the creatinine is. Ammonia should always be less than your sodium level. So if somebody's ammonia level is climbing up into the 130s and 140s or 150s and their sodium level is dropped into the 130s, we've got some problems. Chloride should be less than a sodium level. Protein should be less than their phosphorus level, and we'd like to see that INR less than a person's albumin. And all of those numbers that should never cross stay in the back of our mind, so when we see some of those numbers, it's really worrisome when we begin to see those cross. Now I'm going to give you a list of some significant numbers and cutoffs. So hemoglobin, we don't like seeing that less than 7, and we don't like seeing it more than about 16. Platelet count, we really don't like seeing that less than about 50,000 on the lowest end, or higher than 500,000 on the high end. Calcium, we really don't want to see that below about 8 or 9, and we don't really want to see it above about 12. 13 is really getting worrisome. Albumin, we want to keep that between 2.5, maybe 5 or 6. And potassium, we don't want it less than 3, and we don't want that more than 6. Now let's move on to some basic information about imaging. X-rays have been around since the late 1800s, and it's best for bones or evaluation of teeth, but it can also be used for looking at some soft tissue things, such as with the chest X-ray, where we're looking for a pneumonia, or we can see a mass, and we can outline what the heart looks like. We can see congestive heart failure. So a plain film can give us a lot of information, but it doesn't give us all the information. For a while, we had a lot of interest in fluoroscopy, sort of a moving X-ray. And I don't know if anybody's old enough that they remember putting on a pair of shoes and standing on that, and you could see your feet and toes wiggle inside of the shoes. But Thomas Edison and Clarence Dally really published a lot of information and pushed that fluoroscopy. They found out the hard way that too much of that X-ray is bad for us. That's a real-time X-ray, and we still use it to look at the outline of when somebody swallows, how that food goes down, to find out what's the stomach lining look like. Mammograms are a form of X-ray. It's an X-ray with compression, but it's a really low radiation X-ray that we use. Ultrasound is the use of sound waves. 1956 or thereabouts is when we really started using that medically. Found out it's a really good way for the sound waves to go through soft tissue and fluid to look at the solid structures behind it. And in the 70s is when we really started using that with pregnancy evaluation. If you think about some of the other things where there's maybe fluid and solids together, gallbladder, liver, uterus, maybe somebody's abdomen if we're looking for ascites, or maybe a blood vessel if we're going to look at somebody's carotid arteries. CT scan, or computed axial tomography, that's been around since the early 1970s, and it's a series of X-rays. It is more radiation than in a plain X-ray, and it's taken from different angles. And then the computer puts those images together to provide the detailed information, and it sort of looks like slices through the body, either from front to back or from top to bottom. But it provides cross-sectional soft tissue information. It's really rapid, and it provides a lot of accurate information. It can be done with or without contrast. And so typically if we're looking for an abnormality maybe in the intestines or the abdomen, they may do it first without any contrast, and then the next time they may do it with contrast. Sometimes the contrast is through a vein, and sometimes it's because they give you the contrast to drink. Terrible stuff. It provides data to help discern maybe an injury, or if there's been a trauma, or if we're looking for a tumor, or it can actually guide us for a biopsy. The next test I want to talk about is the PET scan, the positron emission tomography test. And a PET scan is a type of nuclear imaging that looks at activity in a body area. The gamma camera first was developed in the 1950s, and it was improved in the 70s and then again optimized in the 1990s. And what it looks for is it looks for uptake of metabolically active tissues. And so what they'll do is they'll use a radioactive tracer, and it's tagged with a sugar, or the sugar is tagged with the tracer, and then they'll administer that, and then they'll take special gamma camera pictures to find out what organ system is really using a lot of sugar. And Common places would be for a cancer or a malignancy, a neurologic problem or neurologic disorder, seizures, Parkinson's, dementias. So the PET scan gives us its own set of information, different than the other tests we've talked about. There are multiple other imaging tests. Of course, the MRI, nuclear magnetic resonance imaging, the nuclear medicine scans, the hepatobiliary scan, scans directed at biopsies, thyroid uptake scans, targeted blood cell scans to tell us where maybe a bleeding source is coming from, and myocardial perfusion scan. There are side effects and risks of any test, with every test. Worry, anxiety is one of them. And does the test cause more tests? If you get a false negative, you worry that it missed something. But if you get a false positive, it shows you that there's something abnormal, but maybe there's really nothing abnormal there, but it warrants another test to disprove that. So if you get questionable results, it leads to more tests. Worrisome results vary by patient age, circumstance. What reason are we getting those tests? What's the location? What's the size? What's the uptake? What's the complexity? Is there lymphadenopathy? Is it simple? Is it complex? So depending on is it a lab test or an imaging test, there are so many factors we have to consider. Maybe the test was done and it's an imaging test and things don't look like they're in the right place. So they almost always will put a comment in there, compare it to prior studies. Well, maybe this is the first test you've had. So is another test warranted? Do you want to go through another test? And then at what interval? Tests can cause injury by radiation. Maybe you needed anesthesia for the test. Maybe you had to have a procedure done, and so there could be bleeding or infection. Then we have to gauge what's going to be learned. What are we going to gain from doing this test? And is it going to make the person better, or is it going to lead to more tests that's still a dead end? It still doesn't get us any information. Do we risk a potential reaction to something? Like if somebody has to have contrast dye, maybe they could have an allergic reaction, or it could damage maybe their kidneys or another organ system. And we haven't even touched on the cost talk. Tests certainly cost a lot. Now let's talk a minute about the people reading those tests. Radiologists are going to be doing most of the reviewing on your imaging, and your physician and you are going to talk about your blood tests together. But what if your radiologist was tired, or they have a cognitive bias? Let's consider the radiologist's mindset, their fatigue. There are limits to what human interpretation can provide. But I don't know that we want to turn all of this over to a computer. Another consideration is how often we're going to have the test and which ones are we going to follow. Some tests are clinically unnecessary. They just really are. So we need to consider, why are we doing the test? Are we doing it because we're worried about liability? Are we doing it because of a prior test? Was the person seen in the emergency department? Are we doing it because we're curious or just to be safe? Is the family wanting to know? Do they need to know for genetic testing? Do they need to know for health risks for other family members? Or is it just, again, curiosity? Tests after the physician talks with the patient about the test, they can decide together, is this test warranted now? Should we do it at all? Should we put it off? Sometimes it's just easier to order the test than it is to sit down and discuss it. I think it's best to want more information and to take the time to discuss it with your physician. Talk with the physician, and you have to have approval by insurance. You have to have that balance of risks and benefits along with cost. In summary, today we had a very cursory review of lab and imaging. We all like information, and we want to have test results that are meaningful, cost-effective, and low risk. And we want to keep track of them over time. I do suggest that you keep a copy of your results. Just put them in a notebook when your doctor gives them to you, and then put it on your shelf. If you ever change physicians or if you ever move, you've got your notebook of test results that maybe goes back months or even years. Talk with your physician about your lab test results or your imaging results. Write that stuff down either on the test result, but keep it in your notebook with the test result. Familiarize yourself with the labs that you know you need to follow for your particular health, and help your physician decide which ones are appropriate and at what intervals they should be followed. Get what you do need to have done, and get it done when you need to have it done. Talk with your physician about acceptable drift, because we know these labs are going to change over time. Everything changes. What's acceptable for you? How much drift is acceptable for your particular health situation? If this general overview spurred other questions or topics that you would like covered, leave a comment below and let us know what you want to hear about. And I want to say a special thanks for the people who've given comments about Dr. T. I want you to know Dr. Tartaglia is doing well and that she hopes to be back on the channel very soon. Her list of obligations has grown as her private palliative consulting business has increased in the number of patients that she's caring for. And I'm also really proud to say that she has the esteemed honor of becoming one of the founding physicians at the New Orlando College of Osteopathic Medicine. She is a critical contributor to the curriculum design there. She truly appreciates your comments and concerns, and I certainly miss her presence and her contributions to the videos, and I know that she's going to be back real soon. Thanks for your comments. Thank you for giving me your time today. Bye now.